If you take the overview, so we can say it is a coupled movement of talonavicular, calcaneocuboid, and subtalar joint. Means when you are moving the first forefoot, the other joints, peritalar joint, all moves along the forefoot movements. So that is the concept of the coupled movement. So correction of the Ponseti is simultaneous or synchronous correction of the midfoot and the hindfoot, whereas when forefoot correction is done. In typical clubfoot gradual correction we correct the varus, inversion, adduction simultaneously, and lastly we do the equinus correction. In non-walker children, same methodology. In majority of patients, you need a percutaneous tenotomy and the bracing for 3 to 4 years. And then in older age, again the methodology is same, but number of the casts may increase, and percutaneous tenotomy usually is required. And sometimes then there is a relapse. You may need another corrections with the tibialis anterior transfer, particularly in the relapse. So I can say the early intervention yields the good results, and start treatment as early as possible within the few weeks, few days after birth. Weekly manipulation to use the viscoelastic properties of the soft tissue and not sudden movement of the breaking the midfoot. Do not ever stretch so that the tissue should not break, but they, because of this viscoelastic property, they get elongated. So never overstretch, never prone, and always check comfort in the cast and the brace. Brace is usually maintained for the 4 years. Initial 3 months to 4 months, they are used for the 23 hours a day and 1 hour for the dressings and the dressings and the cleaning and washing. So I can say no technique can yield a proper desired result unless master's instructions are followed, and surgery can be avoided most of the time if principle of masters are followed properly. And best way to achieve excellent results are the setup of dedicated clubfoot clinics. As you say, here there is a teamwork, there is a dedication to this, and the parents' education, continuous dedicated clinics, CMEs, and the posting, and the parents' education is very important to achieve the best results. Thank you very much. This is the contact numbers. You can follow me.